Glaucoma is called as the silent thief of sight. It silently takes away the eyesight and the patient gets to know about it when the disease has really reached almost the end stage. So what is glaucoma? Glaucoma, also commonly called as kala motia or samalbai in common languages, is a condition that affects the optic nerve. It affects the nerve of the eye, which basically is the center point where all the retinal cells come and merge. So glaucoma usually does not affect the front vision to begin with, and hence the patient doesn't get to know that the patient is suffering from something. So while a patient may be seeing in the front gaze absolutely normally, the glaucoma silently cuts down the peripheral vision to a stage where the patient comes to us when they begin to bump in the objects around, and that's when the glaucoma has already taken almost 60-70% of your eyesight. Glaucoma is usually a disease of old age. Although yes, there are juvenile and congenital glaucoma. Yes, there are glaucoma which can happen because of trauma, but the maximum part of glaucoma happens as a old age. So who are at risk of glaucoma? Anyone who is above 40 years of age, anyone who is either a diabetic, hypertensive, have thyroid disorder, anyone who has a family history of glaucoma, or anyone who has been on long-term use of certain medicines like steroids or antidepressants can be at risk of glaucoma. There are many other risk factors associated with, but these are the predominant risk factors, and anyone suffering from them or falling under the category should be getting their eyes checked regularly. How does glaucoma affect us? Like I mentioned, glaucoma does not affect the front gaze to begin with. It is the peripheral vision that it affects. So how we as a patient are gonna aware of it, how we as a patient will be able to understand that glaucoma is affecting us. That's where the role of regular eye checkup comes. As an ophthalmologist, we have battery of tests which help us identify whether this patient is suffering from glaucoma. Few of them are checking the intraocular pressure, getting an OCT scan for the retinal nerve fiber layer, and checking the visual field to see if the glaucoma has begun to affect our visual field. People are often scared that if we are diagnosed with glaucoma, then we will lose our sight. Gone are the times when glaucoma would take the sight completely. If the disease is diagnosed on time, then with the help of very advanced medicines that we have in our armamentarium, glaucoma can be very much controlled. There are very few percentage of patients who would need surgery in today's scenario, and most of them, either with the help of laser or with the help of correct medications, can be very well taken care of for glaucoma. What can we do as a patient to ensure that we don't get glaucoma? Unfortunately, there is no specific list of preventions or cautions that we can have as a glaucoma. So I always give a word of caution to my patients that if you get yourself checked on time, if you get yourself diagnosed on time, then glaucoma would not make you blind. It is just like any disease which happens with age. It's just like getting diagnosed with diabetes or hypertension. And if we are aware of the disease on time, then with the help of correct medication, it can be very well taken care of. Needless to mention, if we maintain a healthy life, if we exercise regularly, and if we ensure that we are not suffering from any other metabolic disorders, glaucoma can yet be avoided.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.